Dear friends, in our program of education on health, we are taking now the last chapter on diabetes, which is chapter 5. The previous chapter, we saw the complications, the consequences that comes when blood sugar is not controlled, when the diabetes is not controlled. The complications are more than just physical. They can go, the complications to the family. The family go under terrible stress when you have a patient, especially when the patient is under poorly controlled blood sugar. It goes to the community indirectly. It affects the country. We saw in the previous presentations the incidences and the prevalences of diabetes, the burden it constitutes to the countries, particularly countries that are underdeveloped. Now, let's see if you can summarize and see the treatment, the preventive measures that we can put in place to mitigate this health burden of diabetes. It's going to be the last chapter on this. We try to summarize it, and we try to see if we can understand the best possible, the best ways how we can mitigate this burden of diabetes. The part 5 of this topic, we are going to go a little bit into details on the ordinary measures that we can try that are affordable. You know, yes, there are medications, but let's see the most applicable measures that we can put in place to prevent the complications. So we are going to see them by answering this question on treatment and prevention. There are SMART goals that people set down and design, A, B, C, D, F. If you try to follow this A, B, C, D, F, you know you have a diabetic patient at home, or you know you are diabetic. If you apply A, B, C, D, F, you will be able to achieve a lot. We saw hemoglobin HbA1c. You know, we saw that if it's always below 7, preferably 6.5, as we saw in the previous presentation, you will be in a very good direction. If your blood pressure, because we saw there is a close link between high blood pressure and diabetes, you try to keep it at 130/8. That around, if it is around this value, then you are moving very well. Cholesterol, we saw a negative impact of fat in the risk factors, especially the one called LDL, which is very toxic actually, which causes problems. If they take blood, your cholesterol, and they find it is high, then it will be a problem. So the SMART goal now is to make sure that your cholesterol is controlled. That's why most of patients who have diabetes, high blood pressure, they will also give them the medications to fight cholesterol because they know the negative impact it can cause. If now the patient is diabetic and has high blood pressure, they will give either the medication which will fight for fighting the blood pressure, which is the angiotensin converting enzyme inhibitors, or giving also the statin, the one which will lower the blood, the fat in the blood, or aspirin to make blood smooth, run softly without the formation of clots, which would create complications that we saw. We are advised to do exercises, eating healthy. We know what is healthy food. We know what is not healthy, unhealthy food. We will have a topic specifically on the diet. We will ask one of our colleagues to do a presentation on the diet once somebody is diabetic. That presentation is coming soon. Smoking cessation. We know very well that smoking have a negative impact on the vessels. The cigarette smoking does damage the vessels. So if now you have a diabetes and you have a smoking habit, the damage is double. It is doubled. You see, the diabetes now requires lifestyle modification. Not only cessation of smoking, if you haven't started, you are discouraged to start. You know, you better start education at a younger age. For those who haven't started yet, it's not a good way to go. Aerobics exercises, we advise to do exercises at least 3 times per week for 30 minutes. If you cannot do it every day, just try 30 minutes every week. We saw body mass index. Body mass index, they should do always, if we can, to keep it between 20 to 25. If it is above, but should not really go above 30. Above 25, it's overweight. We know that. Moderate or no alcohol intake. Alcohol has a negative impact, particularly on that precious organ that we saw, pancreas. There is what we call pancreatitis, alcohol related. Alcohol can damage the pancreas. We need to know that. Correct meal, correct time. Dietitians will be advising us very soon on what meal we should eat, whether you are diabetic or not diabetic. Education on food care. Because the food, we saw the complication, the ulcers, when they get infected, the complications with amputation that might follow. Food care is very important. The food care should be checked on daily basis. Check if there are no lacerations, no wounds, no fungal infections starting coming there. Those should be treated as soon as possible. You need to keep the food, all the feet should be kept dry and clean at all times. If you cut your nails, cut them straight. Don't cut to the point where you're able to injure yourself. If you're putting shoes, they're shoes which are fitting properly, not the one which will be squeezing and eventually interfere with blood circulation, which can expose again to the damage of the skin and the vessels, and the infection will start. And if there is any problem at any time, skin lesion, check to the physician. Very important, very advisable. Now, if the time now arrives that you need to start medication, you are put on treatment. You are advised to take them regularly. That's what we call adherence to your treatment. You can put a reminder in your phone. You can put a reminder in your watch so that it rings. Then you know the time of taking my medication is this, and you need to monitor your blood sugar. Get your machine to check, is my blood sugar controlled? Take a pen, take a notebook, write on daily basis. Once you take your medication, you are monitoring your blood sugar, and they're always normal. You should relax. You know that everything's in order. You check your blood pressure. We saw that there is a link, a close link between diabetes and high blood pressure. Once you control the blood pressure, you are moving very well. If it happens that you are on injection, you are given insulin, because the tablets, they are those which help also on the increasing the sensitivity of blood sugar to the muscles, to the cells. Insulin, if it is absent, or if you are at a level where you need insulin, then you need to be educated as well on how to use your insulin. Not only to know how to use it, but also to know how to keep it cool. Where do you keep it? If it's not well kept, it will get damaged, then become useless. So there are doses that the doctor will prescribe for you. Most of times we go to 0.3 to 0.5 units per kilogram. If, for example, you are 50 kilograms and maybe your weight is not too high, not too elevated, and they decide to give you 0.3 units per kilogram, if you are 50 times 0.3, then you'll be having 15 units per day. So 15 units, you will take a 2/3 in the morning and 1/3 in the evening. 2/3 will be 10 units, 5, which 2/3 is 10 units, and 1/3 will be in the evening. So the doctor will teach you, will show you how to use it. So we have maybe a time separate for just the presentation for medication alone, separate for the diabetic drugs, how to use them, what to do, what to avoid. So we saw the risk factors. The risk factors need to be addressed very properly. We saw that this fat can go and cover the pancreas, and we saw the negative impact of cholesterol if you keep on eating the fat. Not only fat, wherever the fat is coming, particularly animal products, meat consumption that we eat on daily basis, as if we're in the competition, we need to know what they are coming with. We need to be aware. That's a reality. Cigarette smoking is not part of the plan we should have. Cigarettes should be stopped if possible, and should be possible. We should monitor our blood pressure so that the blood sugar and the diabetes is well controlled. It's a package. There is a very good advices that you can find. If you put a new start on the internet, just a new start, you will see these beautiful advices that we are given. If you take a proper nutrition, we are doing exercises, we are drinking enough water, we do sunshine, we know that the body needs water. We know that we need the sunshine so that the vitamins can be converted, particularly vitamin D. We are temperate. We have a temperance. We are moderate in everything that we do. We don't exaggerate in everything that we do. We get fresh air. Where you stay, you are breathing fresh air. You get enough rest. You get enough rest. And again, you trust God. We do not create ourselves. We need to trust God in all these things. If you apply this, one of the good weapons we can use to fight these diseases. So this should come in combination of the medication. Medication alone will not work. So we advise that health food, fruit, vegetables, legumes, particularly those which are colorful diet, will be the best. The low sugar, low fat. Then exercises they are telling us. Please visit a new start. You will see it will give us, each can be a chapter itself that will give us very good input. So before we conclude, there are 10 advices that are given. 10 advices that are given to us that can help us to beat this diabetes. One, we try to understand your diabetes. If you have it, if your mother, your father, your child, your neighbor, your friend has diabetes, try to understand diabetes. Please share the message. Try to understand diabetes, then try your best to understand what is the normal blood sugar. When do we say the blood sugar is high? Do you know the normal value? 2, try to understand the causes of diabetes. What are the risk factors? Try to know them. Number 4, try your best you can to monitor and write down on daily basis. Take a pen, take a notebook, record on daily basis. Record the time you go to hospital, the time you're going for your follow-up, show what you have been recording. That will be very helpful. Number 5, try your best to understand the signs and symptoms. If you have somebody whom you know has diabetes, or you start getting, do you know how to start suspecting that these are the symptoms of diabetes? How would you educate somebody who needs to know about diabetes? Number 6, you try to understand the complications. Try to understand what are the risks. If this blood sugar is not controlled, what are the complications? What are the consequences that are coming if my blood sugar is not controlled. Number 7, if you are taking your medication, take them regularly without interruption. That we call compliance, adherence to your treatment. Number 8, try your best to understand the treatment and preventive modalities. So we are summarizing everything that we saw in the previous presentations. You try your best to apply this. Number 9, try to go to the hospital. Consult immediately if you find any problem. You have a skin lesion, you get a broad vision. Whatever you see, consult before it is worse. The last one, try your best to commitment. So in life, if you don't commit to what we do, we fail. So the commitment is very important. Dear friends, I thank you so much. Thank you for following this presentation. Thank you for accepting. I have great faith that many people are going to come on board. You are a health professional, you are a volunteer. Please, let's help each other to beat this pandemic. We have been talking about corona. Corona it cannot reach where the diabetes has reached so far. Trust me. Actually, there is no, corona cannot be so severe if there was no diabetes, if there was no non-communicable diseases. Let's address the problem from what? The cause, the root cause. If you are healthy, COVID will not be a problem. It will come and go. It will be like a flu. So let's keep informed. Let's inform each other. Let's help each other. Better to prevent than to treat. Thank you very much. Always asking everyone who is willing to take a part in health education, in health promotion, to share ideas. You can send emails, you can put comments, and see how we can move together in this battle, in this journey. Thank you very much.